Muscles of the upper limb. Deltoid. This here is what's left of trapezius. The next four muscles are the sits muscles of the rotator cuff. They're called sits because the first letter of each muscle spells the word sits. They are supraspinatus, infraspinatus, teres minor, and subscapularis. You can see that all the muscles of the rotator cuff insert around the top of humerus here. This muscle here is teres major. It is not part of the rotator cuff. You can see it does not insert around these rotator cuff tendons. Between teres minor and teres major, you can see the long head of triceps brachii. It originates here on the inferior border of scapula. The other two heads of triceps brachii originate on humerus. They are the lateral head and the medial head. And they all have a common insertion here at the olecranon and a common action. They extend the arm, or the forearm, at the elbow. This here is anconeus. So the antagonist to triceps brachii is biceps brachii. It has two origins. You have the origin here at the supraglenoid tubercle for the long head of biceps brachii, and the origin here at the coracoid process of scapula for the short head of biceps brachii. Both heads insert on the radial tuberosity, and they both flex the elbow. Also originating from the coracoid process of scapula is coracobrachialis. Originating at the medial shaft of humerus, we have brachialis. This is the primary flexor of the forearm. Because coracobrachialis crosses the shoulder joint, it is a flexor of the arm. The following muscles have a common origin either at the lateral epicondyle of humerus or just above it. So this one that's just above it is brachioradialis, flexor of the elbow. Now we have our extensors. We have extensor carpi radialis longus, extensor carpi radialis brevis. Coming all the way to the fingers, we have extensor digitorum. Coming just to finger 5, we have extensor digiti minimi. And then finally, just coming here to the wrist, we have extensor carpi ulnaris. And then here's anconeus one more time. The outcropping muscles that go to the thumb are abductor pollicis longus, extensor pollicis brevis. Do you see how it stops here? And extensor pollicis longus that goes all the way to the distal joint. Hiding underneath here is extensor indicis. So removing these superficial extensors, we now have supinator and pronator teres. The next four muscles have a common origin at the medial epicondyle of humerus. They are pronator teres, which pronates the forearm, palmaris flexor carpi radialis, palmaris longus, that inserts here at the flexor retinaculum, and flexor carpi ulnaris. Our next layer is flexor digitorum superficialis that inserts here on fingers 2 through 5. And if we go underneath it, we have flexor digitorum profundus that actually crosses the distal interphalangeal joint of fingers 2 through 5. Here you have the thenar eminence with adductor pollicis and our hypothenar eminence. And here is the extensor retinaculum.